Welcome to the Geeta Chopra Show. This is your time to heal naturally. Embrace nature's healing energy. Get back in tune with your higher self through yoga, meditation, healing foods, living in balance, healthy relationships, and harnessing the true power of prayer. You are powerful, you are loved, and you can do it. I am Geeta Chopra, and let's heal together, naturally. Welcome back to part 2 with Elise Berry from the New Jersey Pharmacists Association and Ruth Marietta, past president. Welcome back, ladies.
Thank you. We're glad to be back.
All right, good. So we can pick up where we left off. We were talking about painkillers and the opioid crisis. And I think what we were discussing was, where does the burden actually lie? Whose responsibility is it? Because we clearly have a serious problem. So we did discuss doctors, we discussed the patient level, and also the pharmaceutical industry. So I'll let you open up with your first comment in terms of responsibility to try to navigate this problem, if you like.
I think we all have a responsibility to navigate the problem. The problem arises when there's too much pain medication that is prescribed for patients, either too much, not the right type, in larger quantities. And really we want to look at the leftover of the pain medication from somebody that is already addicted to it. If they have access in your house, when you have your pain medications left over, you should lock them up.
But why let it get to that level? So I think what a lot of millennials or a certain focus group out there is saying, that we wait till we get to a certain level till the person is addicted, and then we kind of pull the plug. And then that causes for other problems, obviously, like withdrawal, crimes, depression, then they need antidepressants. So it's kind of like, why get to that level? Is there something else? I know we spoke to prevention earlier. Is there some other way, or maybe just to take it very short term, like 5 days for acute pain, and then immediately go to physical therapy, massage therapy, yoga, like it should be mandatory? Or what other suggestions and ways are there?
Correct. Well, if you recall, in New Jersey, Governor Christie came last year, put a law into effect where for acute pain there's only 5 days of an opioid that can be prescribed. Beyond that, there's a couple of more guidelines, and for the acute problem, you know, there's other things that can be utilized. You can go to physical therapy.
But even for chronic pain, don't people go to physical therapy
absolutely,
to reheal the scar tissue?
Absolutely. For chronic pain, physical therapy. There's also antidepressants that possibly can work on certain pain pathways in the body.
So then how is this problem escalating? If there's so many good alternatives, how is it escalating into full-blown addictions in society?
What happens is, also the pain medications work on what's called dopamine. It releases the dopamine in the body, and that's a feel-good neurotransmitter chemical. And because that gets released, the person wants more of the opioid. But there's also other ways that dopamine gets released in the body, if you learn new and exciting things.
And how about exercising, jogging? Endorphins get released?
Sure. Yes, absolutely. Massage therapy, things like that.
So these are great suggestions.
Great suggestions. But because we're at the problem that we have now with the crisis, the physicians are looking at patient medication profiles. They're looking at the state PMPs, and they are getting more serious about prescribing less and less, and putting it in the hands of others who may come across that.
Sure.
So that's where we are right now, and I'm sure we're going to be looking for future measures to alleviate.
Oh yeah,
that.
It won't be sustainable, and I think that's a really good point. But if you go back to the doctors, I think that's the starting point for me. Like the physicians, if they are just not informing patients rather, on self-healing mechanisms, even simple things for pain management, or advising them that this can be, at the very least, advising them that this is an addictive drug. You know, if they're not doing that, I think personally what I would say is that the level of responsibility falls on them, that they really should have stricter guidelines of what they're telling people, because people don't know that this is a drug, or they don't know that they could end up in NA, Narcotics Anonymous, or go to rehab, or actually ruin their life, you know. And the side effects, not just of addiction, but then the whole other host of side effects. So they're not informed. And then I just feel that they're not counseling them for other safer alternatives, and say, well, you can take this prescription, but a safer alternative with no side effects might be A, B, or C, or take at your own risk. It's kind of like they not enjoy, but it's just natural protocol to write their prescription. You have pain, oh, you can't live in pain, we must give you a prescription. So I think a lot of the burden lies there. And they're not mentioning the exercise components, the other ways to release endorphins or dopamine, which I'm sure there's several. I'm not medically qualified here to, you know, to announce what they could be. So that's what I think, and I don't know how this can be addressed.
Well, we have to recognize too that patients who are in pain go to the doctor because of their pain.
Yeah.
So the doctor is trying to address that pain, and it could be, as you say, with a prescription, it could be other alternatives, but they've already gotten to the point where they feel they need the doctor to intervene on their behalf and give them something for this pain.
Well, if the doctor has their best interests at heart, they would, again, they can address the pain, but maybe in a safer way. Well, why does it have to be with the harsh opioids?
Medications, because of our government system, the FDA, they are considered safe if they're taken properly. And again, each person has a different tolerance for a medication, a different reaction to a medication. So all of that has to be taken into effect. So I think that it would be helpful for patients to realize that they do have the ability to be their own advocate. If they feel that they want to just take a very limited amount of medication because they're concerned about this crisis, then they should bring that up to their physician and say...
But shouldn't the physician kind of bring that up and say, you know, these are really harsh...
I know my physician does, so I can't speak to every physician.
Because a lot of times they really, really over-medicate. You know, if somebody has a very small infection, they'll prescribe too many antibiotics, and all of a sudden the guy has candida, or I guess we can get back to opioids, but a very small pain can turn into a full-blown addiction.
I think that may be a smaller percentage than we...
But that's so
That's
common.
what we hear about, but that doesn't necessarily mean that it's happening to everyone. And again, if you have a side effect that's unanticipated or that you didn't expect, whether it's on the package insert or not, you should have more of a conversation with your physician or the nurse in the office or the pharmacist, because again, it may just be an isolated case.
Well, let's talk to side effects. So you mentioned earlier all the drugs have side effects. Some of these side effects, most of them are deadly. I mean, they're so extreme. What are the side effects of tramadol? Well, let's talk about tramadol. You mentioned that earlier.
Tramadol is a weaker one, but I'd rather talk about like a more controlled opioid, like oxycodone.
Okay, let's do oxycodone.
Or fentanyl, or
that's usually
hydrocodone.
given to cancer patients, right?
Well, it's also
surgical
used
patients.
Severe pain, in other words.
In surgery, in dentistry, and other, you know, for acute pain, but some chronic patients still do take that.
But people, like taking 6 months and longer, so that could destroy your whole chemistry over time.
Well, we also know it causes a lot of drowsiness.
Well, I mean, drowsiness is not really, I mean, that's not life-threatening, kind of.
Well,
but I'm talking about the
driving, it
internal
can be.
chemistry, makeup, or, yeah, sure. You can't drive, so your lifestyle would change, or your daily. But what about, I'm talking about the irreversible damage to the organs and all that other stuff. So how are people, how are doctors okay with this?
They're actually not. The doctors aren't okay with this. So, but what an opioid could do, and if you overdose, even if you overdose on heroin, the opioids, it can shut down it causes respiratory depression. And the respiratory depression means that it slows down your breathing, and you could stop breathing if you take too much of it. And this is how people overdose, and it could lead to coma and death. So I mean, we can talk about Narcan and how that rescues somebody, but if the person takes too much, it could be because they themselves are taking too much and they're not taking their medication as prescribed.
Well, it also turns into a basket of pills because one thing will cause another, then they give something else for that. So it's kind of like a cycle of dependency, which creates more problems and more side effects. So it's like a never-ending cascading effect. And that's where some of the criticism comes from. You know, we're the voice of concern these days. So they're saying, well, we'll just get our herbs in nature. Everything's there, all the medicines in the forest. Or food. Food is my medicine. So a lot of people are now relying on that because they just can't handle the side effects. So the side effects are a huge debate and problem, you know, notwithstanding the addiction part of it. So that's another thing, right? And it just turns into over-medication because then they need something else and something else, you know. So how are doctors, well, why would they not address that issue is where I'm concerned.
Well, I think doctors are addressing it. I think they have, because
they certainly know this.
They have their patients come back for visits.
Mm-hmm.
They assess them at that time. Most doctors will not prescribe opioids or anything for pain with refills on it, and depending on what class of drug it is, you can't have a refill on it. So that prompts the patient to go back to the doctor and have that discussion.
Mm-hmm.
Perhaps the doctor is having a discussion with the patients and they're not taking up on the advice.
So I guess, forgive me for asking this, but what's the point of all of this since it doesn't cure the problem of any of these pills?
It may cure many of the problems. A surgical patient who has to take it for a temporary amount of time, they get over
The opioid or the
opioid.
Okay.
They get over the pain as their body heals. And so the opioid that's prescribed in that particular case, and I'm not saying this from a medical background, but just from practicality, it's allowing the body to do its work to heal. It's
okay, so it's not weakening the immune system in the meantime by causing all the side effects in your liver?
A surgical procedure, your average length of recovery is maybe 4 to 6 weeks. So you may be taking a pain medication for 2 weeks, 3 weeks,
But
perhaps.
that won't impact your immune system in terms of the healing system?
Well, you still have to heal.
But the painkiller won't suppress that effect at all? It will have a zero effect on it? Is that what they're saying?
You would need to have a physician to describe that. But again, you have to give the body time to heal. And so allowing the pain to subside enough for you to allow your body to heal is part of the process.
Mm-hmm.
And it's very successful in many, many cases.
Well, yeah, I mean, I guess success that's kind of arbitrary, depends how we're defining it, but if you look at an example of someone who had kidney stones or something, like my sister, and she had such severe pain, she couldn't walk, she couldn't even talk. So we took her to the ER, obviously she had to take a painkiller, and then, but the solution is not to keep taking painkillers, it's to dissolve the kidney stone.
Right.
Correct.
So at some point you have to get to the root of the problem, or she could keep
Right.
coming in. I'm sure she has pain now, you know, a couple of days after she went in, but she's not looking to get a pain prescription refilled. She's looking at how can I dissolve these
Right.
kidney stones ASAP. So what is the root of their problem? And that's getting overlooked, you know, and they're just getting well, I have this pain, so now I'm entitled to get drugs, or now I can do this or that. And the doctors are going right along with it, and they're misinforming people by saying that these things don't have long-term effects, because they do. They shut down your brain so you can't feel pain, you don't have the receptors, and that cannot have a good effect on your immune system. If your brain is shut down and you're slower, so to speak, I don't know what the medical term is, so is your immune system, so is your immune response, your white blood cell response. There's no way that this is enhancing your immune system. And the side effects of the headaches, the diarrhea, and all that stuff that come with it are proof that your whole body's out of balance. So I wouldn't say it's speeding up the healing mechanism. It may just make you feel like you're better, because now all of a sudden you don't have pain.
Well, I'm talking about a surgical patient whose issue has already been resolved through the surgery. So now they're in the healing process.
Well, any patient, yeah, sure. So you need time to heal.
Sure.
But these are not helping you heal. These are counterproductive to healing.
But they're not curative.
They're drugs.
They're meant to, well, some drugs are curative. Some drugs, like the antibiotic, will help you get better.
Well, the antibiotic also destroys
that's
all your
still a
good
drug.
bacteria, so you'd have to take probiotics after that, which they're not telling people, which is a big problem, and that's
Well,
another problem.
I wouldn't say that they're not telling people. This is becoming more and more. I mean, medicine and healthcare is all about research and awareness. So,
But doctors aren't telling people you can get candida from taking antibiotics.
You can't say that. You can't like put that in a one for all. we don't know what
I
the
mean, they're not. They're clearly not.
But
right?
I can safely say in my practice, I see that patients come in and say, oh, doctor wants me to get a line, a probiotic, to where can I find that?
Yeah, so then in that case they are. If they're prescribing the probiotic with the antibiotic, then they've done a good job. But the majority of them are just, it's kind of just now coming up.
Not everybody may need a probiotic.
So you're saying that they could take an antibiotic and not
need more probiotics.
Be at risk for candida after taking an antibiotic course?
Not every antibiotic is going to cause candida.
But don't all the antibiotics kill all the microbes in your body? Or you're saying they...
Not all of them. They kill off some of the good ones, but not necessarily. See, the thing about medicine is that it's not, we can't think to put it all in one box and just say that because this causes this is going to cause that. Every medication has a side effect. Every medication will have a side effect, but the point is while you're taking that medication, you need to take other measures to try to get through the problem.
But who is going to tell them this? And so, okay, so the problem is twofold. One, just to backtrack, antibiotics, that oversimplification statement is very dangerous, and that's why a lot of Americans have IBS or whatever they're being diagnosed with. It's really candida, which is a silent killer. They have an imbalance of good and bad bacteria in their life or in their body because of it's an overly antibiotic society. You have this, you have that, oh, no problem, pop an antibiotic. So that, Americans are definitely low on good probiotic levels, and the doctors are not telling them that, and now you're saying it depends on what you do with it or, you know, the other things you do when you're taking antibiotics, and one of those things should be eating probiotic food or taking a probiotic course, you know, 2 weeks after you're done. And they're not being told that. They're not being told that.
But I can't
How can they know?
But I can't say for sure that they're not being told
But
that.
in general, they're not. It's not the prescription
But
here.
I can safely say in my practice that I see that happening. I see.
Do you work at a doctor's office? Or?
I work at a pharmacy. I see the patients coming
So
in,
they come
and
in
it's
with
either written on the back of their prescription, get this probiotic.
That's good, and that's changing then.
And I counsel people. I also counsel people, and not will I only recommend a probiotic. I may recommend using Activia. Which is a food, you know, a probiotic
yogurt,
found in the yogurt. So it's not necessarily like just all about medications. There's other things that...
Well, those little things like telling them to take probiotics could be the difference between disease in the future and not, because Western medicine is very, very harsh on the system. It's not natural, right? It impacts your liver. So these little things is where I think doctors should be more accountable. That if you have to take an antibiotic, if you're going to die, you know, if you have a bad worm or something, sure. But then they should at least educate the people and say, look, if you don't take probiotics, this is what could potentially happen. Not everyone will get candida, but over-medicating, you likely will. Or you're now at risk for candida. Your immune system is now suppressed because all your good bacteria just got wiped out over the last, 15 days or whatever. So again, I think doctors should really inform people of these harsh side effects, whether you're talking about pain medication or an antibiotic. So yeah, it's just the accountability measure. Now I don't know how the patient is supposed to know this. So
again, the patient has to speak up for themselves.
Okay.
What should I know about this medication? What should I know about this disease or this condition that I currently have? How can I address it if they prefer to address it through foods and herbs and other things? Is that something that can be taken with this medication?
Well, they're all against that. So I can speak for myself, I guess, not for society at large or people I know. But when I've been to doctors, they don't know anything about nutrition. They don't know anything about probiotics, at least the ones I've seen.
But they may refer the patient to a nutritionist.
Yeah, or they say, well, I don't know about that, or I wouldn't do that. Or, for example, should I take acupuncture? Acupuncture is one of the best alternatives to painkillers, Chinese medicine. And I'm a 100% believer in that, and I've personally been to acupuncture, and it's cured me. It hasn't masked my symptoms, it's cured my pain. Whereas people who are taking painkillers are now addicts, and they have other problems, and they're still in the system. But when I asked a doctor about that once, he said, well, I don't know, I wouldn't recommend that, there's not enough research. So that's typically the answer, or we can't say this because we don't want to get sued. I can't tell you to go eat turmeric, then you'll come back to me when you're not cured and blame me. So sometimes it's those little things that they can tell people. You might say, well, go do your own research. You can try turmeric, or why don't you look into this or look into that? But they don't do that.
Well, from the pharmacist's perspective, if a patient were to take turmeric because they felt that that was beneficial to their treatment or they felt that that was the appropriate method for them, they should be telling the pharmacist, so that when the pharmacist and the physician, of course, but if the pharmacist is filling a prescription and there would be some counter reaction because you're taking turmeric.
Yeah, that's fine. That, I mean, it's a blood thinner.
But people don't think of that.
You can tell.
They don't think of that, and so they think it's an herb or it's a.
Well, the doctor should be more informed and say, well, you can take turmeric, but this or but that. So again, it's like when you're going to them for advice, they should be able to have the overarching umbrella of facts. Nutrition, like you mentioned, the exercise. We shouldn't have to go there and say, well, this is what I suggest. What do you think? I'm not a doctor, or I'm not a nutritionist. So they should have more nutritional knowledge, and like you said, interactions and indications of anything. Mint. How does mint interact with Lipitor? Or things like that.
And actually, I know one pharmacy practice particularly, and he does have a nutritionist that comes in on certain days and will counsel patients. And he has some other services that come in to medication therapy management, for example, to go over all of the medications an individual might take and determine if there are alternatives that might cut down on one or two of them, because there's a newer medication now that will take care of two different conditions, the comorbidities that the person may have. But we still have to treat the comorbidities that people have. And the risk-benefit analysis is what's really very important, and that the patient should be part of that discussion.
And just keep in mind, too, that every pharmacist will ask their patient, do you have any questions about your medication?
Yes.
It's always an open-ended question,
Right.
and that's when we get most of the questions, and we can, effectively counsel them on what to do. And it's not always about take another pill for this or that. It's other things that we incorporate into counseling and trying to help people get well and healthy.
Okay, yeah. So I guess we can agree that nutrition advice or nutrition information is a very important piece of this. And then also so that's on the doctor level, just having that more encompassing knowledge instead of a short-sighted vision of, well, this pill or that. So like you said, other stuff. And then the patient having, I guess, self-advocacy, education, awareness, or a vision in mind. I want to be healed in 6 months, or I want to do this. So it's kind of everyone taking responsibility.
Absolutely.
I think so, and people also have to understand that whether or not there will be a full recovery or whether there will not be a full recovery, depending on whatever the condition is, and understanding it and doing their own research, understanding what that means to them and how they can manage it. Someone who's diabetic is diabetic.
Yeah, there's a lot of natural cures for diabetes as well. So I think that just being more open-minded to that, like again, back to the acupuncture episode, not shying away from it. Well, it's not FDA this or that. There's no books written on it. I think just being more open-minded can cure a lot of people, a lot of our population, because a lot of Americans are in pain. So if they're, I guess, more embracing towards those, or at least be willing to research them and then pass them. They're not doing that. They're not passing these. They're just kind of off the radar, and they're going to remain there. Natural cure for diabetes, there's a lot of different types of herbs and seeds that have been proven to reverse it. I mean, for everything, there's a natural cure, then there's the pharmaceutical, answer. So I think just that's more of a long-term vision, more of a shift that we spoke of earlier when I said, could their vision shift, or can they focus on prevention? That might be, 20 plus years. But do you think it could ever come to that where we would talk about prevention, but they could also go more the natural route in the pharmaceutical?
Absolutely. I think with the increased awareness of the opioid crisis and different types of ways of looking at holistic measures and and looking at just a treatment plan overall instead of just one thing will be coming with that awareness. I think we're headed in that direction.
Yes, because I think a lot of people are complaining about side effects, whether it's just the drowsiness, the day-to-day ones, or the long-term ones. I think that's becoming a big concern for people now. So they want something that doesn't have side effects, whether it's food or whatever it is.
Honestly, I don't know if that's at all possible, but yes, we can try to make as many.
Maybe not for
improvements as we
advanced
can.
disease, but maybe for prevention, like to prevent cancer, they can have a certain kind of lifestyle.
Yes, yes.
So maybe they're focusing more on that now. Yeah. Okay. All right. Well, anything else you want to tell the public, or maybe I should ask, what can the public do to address this huge problem in society, the opioid crisis?
Ruth, did you want to touch on naloxone?
Yeah, sure. Absolutely. So what we could do is if we see somebody, or if you know somebody who is addicted to pain medications or opioids, it's always good to just to talk to them. Try to get them to a place where they can get counseling and medical help. There are things to help patients who are addicted. They can go into rehab. They can take Suboxone. But it's most important to know, if you do know somebody who is addicted, try to carry Narcan with you, because if you know that person very well, then you can possibly help save their life if they do become overdose. And some of the signs of opioid overdose are pinpoint pupils, they're lethargic, they're passed out, their skin is cold, clammy, or blue. You hear gurgling sounds, or just slow and shallow breathing. Take their pulse. If you have that Narcan or naloxone on hand, you can just simply give them one dose through the nasal route. If after 2 to 3 minutes they don't come about, you can give a second dose all along. The first time that you discover this, you want to call for help. You want to call an ambulance. You want to call the police, or whoever else can help you with this. And usually the person comes out of it. It's also good to know that the police do carry naloxone or Narcan. It's carried in the emergency rooms. Even some of the schools are carrying it now, but it's also dispensed through the pharmacies. And anybody who knows somebody can come to the pharmacy and request to have nasal Narcan on hand.
Sorry, that was for?
To help to overcome an opioid overdose.
Okay, so that would that's once they are in an overdose state?
Yes,
okay.
in an overdose state.
Okay.
So that
would revive them.
And what is that? Okay, so revive
that would revive them, yes.
But they still need medical attention.
They would still need medical attention. And it's also important, once they come to, they may still have the effects of the opioid in their system. We want to bring them to the hospital. We want to get that opioid out of their system. And once they're down and off of it and they're not under the influence, that's the critical time when you want to counsel them and try to seek medical attention for them, and try to encourage them to either go to rehab or counseling, or to seek medical attention, to take some of the antidote on a daily basis that can be prescribed by doctors. And I'm not saying that it's something that they can be on for the rest of their life, but it's something that can help them through that period or that phase in their time that will get them to a healthy and productive lifestyle.
Okay. Okay, great. Yeah, so that's just some awareness if somebody's in a really bad state, and
Right.
so kind of a emergency.
Yes.
Type of
Yes.
thing. Okay, great. Well, thank you, ladies, for being a guest on
Thank
part
you.
2. I definitely enjoyed the conversation.
Thank you for the invitation. We look forward to working with you again.
Oh,
Thank
you're
you
most
for having
welcome.
us.
Thank you, viewers, for watching. And again, I would emphasize being self-advocacy for your own healing, because doctors do not know it all. You have to advocate for yourself. Hopefully you found this episode very useful, and we will see you next week.